We're here today to talk about raising the awareness of concussion management and how we use a team approach to keep kids safe, really anyone safe, and in the game.
So I would describe a concussion as a blunt injury to the brain caused actually by the skull itself. And a prop will help us kind of see that in simple terms. So if we look at this particular prop, it's not unlike the real thing. The skull is very hard and the brain is soft and squishy. So what happens typically is the skull and the brain are moving together in space and something causes the skull to stop quickly. And so it stops quickly, but the brain's got this momentum and it's soft and squishy. And so the brain's gonna fly forward and smash into that hard, bony structure in the front of the skull. And because it's squishy, it's going to squish into it and then slam back the other way and do the same thing against the back of the skull. So you end up almost always with two injuries to the brain. You end up with a frontal injury or back injury or a side-side injury. The one other way that you can have that same kind of injury is maybe in boxing or other sports where you may get a quick rotation. So now it's not really in motion, it's sitting still, and you do a quick motion. The brain is going to twist on its stem as the skull comes this way, and then the skull is going to stop, and the brain then smashes into the skull on the one side. Same thing happens, compresses, smashes into the other side, and you end up with what you'd call a blunt or non-penetrating injury to the brain as a result of a rapid movement or change in status of the skull.
Headsmart is a comprehensive concussion program that we developed at Meeker Memorial Hospital for comprehensive treatment of the individual when they've had a concussion. Concussion can occur many different ways, and we've come to find out that we can best treat our patients if we put all minds together. If we get the physicians, the educators, the coaches, the patients, the parents, therapists and athletic trainers, if we get us all together, we can make an individualized plan that truly can make a difference in the patient's outcomes. We change our program as we find new research, and we've got an ever-evolving program here at Meeker Memorial, which we're pretty proud of.
We're very fortunate here in our community to be able to have put a program together that allows us to be able to go into the schools and reach out to the athletes and non-athletes to be able to provide the baseline neurocognitive testing and to have the full concussion management program that we do have. And that really wouldn't have been possible without the partnership and collaboration of all the people involved, including the physicians in the community, the administrators at the school, the coaches that are working with the athletes, the parents that have shown interest and involvement in what we're doing, as well as with the Meeker Memorial Hospital support.
One of the tools that we use to assess a concussion is the impact test. The impact test is a computerized test that athletes take under normal circumstances when there is no injury. We strongly recommend to be an advocate and be proactive and have these tests done before there's any injury. That way, if an injury does occur, we can use that impact test as a guideline or a tool to compare what the athlete was like before their injury and after their injury.
After concussion, as far as in therapy, we usually first repeat the impact test. Hopefully the patient had a baseline. We can compare the scores from the baseline to the impact. After that, we usually do exertional testing, which we have the patient get on a treadmill or do running, jumping, maybe do biking. We just try to get their heart rate up in order to simulate the sport that they're trying to return back to. We also do cognitive testing. We do visual testing, and we also do vestibular testing, which tests their balance. With these tests, we can really determine whether or not the patient is back to their baseline and can return to their sport.
Concussions can present in many different ways. You can have cognitive symptoms, you can have physical symptoms, you can have emotional and mental symptoms. Regardless of the kind of symptoms that you're experiencing, recovery is very vital. We want to make sure we work really closely with the patient and the family and all of the parties included, including school, coaches, and other athletes, to make sure that that patient has the best recovery. Sometimes that includes modifications at school, sometimes it includes modifications at home. Regardless, we do not want to send an athlete back to school or back to home or back to the sport too early. We don't want to prolong those symptoms and make their already difficult situation even worse.
During the course of an athletic game or practice, if you suspect that you've had a head injury yourself, or you suspect that another player has had a head injury, it really is the responsibility of everybody, including the coaches and the referees and the player themselves, to remove that person from participation until they've been properly evaluated by either an athletic trainer on the field or by another properly trained medical professional, such as their family doctor.
I think the biggest thing that we can tell the young kids and coaches alike is just awareness of your teammates, of your friends, and of obviously the kids that you're coaching. I mean, a lot of times, somebody will come to the sideline and the coach may not be able to see him or catch him or be able to talk to him right away or directly, but a player or a friend might be able to. If we know the awareness if we're aware of concussions and we know the symptoms and how severe they can affect somebody, especially if it's your buddy, your teammate, you want to be concerned for them. I know we do it in the NFL. I know college programs are starting to do that, and just become aware of the kids and put their best interests at heart. And if we do that, we'll take care of the problem.
If something's not right, if you feel funny, you're on the field, kids have to understand that whether it's one play, whether it's a game, whether it's a full season, that really is a small piece of their whole life. They're 16, they're 17, they're 18 years old, competing at various levels in different sports. They have to make the right choice, and it goes back to advocating and telling that coach something's wrong. It doesn't feel right. I need to take myself out of the game because they have many more years to live for.
Well, if you've gotten hit in a game, if you feel like you have a concussion, for any reason, no matter what the symptoms are, if you have a headache, if you feel nauseous, if you are seeing stars, if you get hit hard in the head and you have a bright flash or something just different happens, you need to go tell your coach. You need to go tell, if there's a medical professional on the sideline, you need to see that person immediately and get off the field. That first and foremost, you need to stop playing because then there's an opportunity to be evaluated and maybe it was nothing, but chances are if you have some of those symptoms, it's something you need to really address seriously. It's something that needs to get you off the field. And there's plenty of time to continue playing football after you've recovered.
It's everybody's responsibility to understand concussions, the officials, the coaches, the parents, and the players, and understand what the symptoms and what a concussion may look like.
I think the bottom line is that we really do want kids to enjoy sports and to be able to play the sport that they want. And by raising awareness and developing appropriate concussion management strategies, we really can minimize the effects that these concussions are having and allow kids to live their life without any sort of long-term consequences of what they played when they were children.
Both as a parent and as a professional, I myself am very concerned about concussions, not only preventing them, but also the management of concussions after somebody has experienced them. There's a lot of research out there. There's a lot of new techniques that we can use to help those individuals and prevent concussions from even occurring. I think the more that we can get the information out there to let people know how they can manage things and how they can prevent them, I think that helps everybody.